Hello and welcome from the World Economic Forum in Geneva. My name is Adrian Monk. Welcome to this Africa media briefing with the WHO across Africa and also featuring guests this week on the informal economy and the pandemic's impact there. So delighted to be joined by Dr. Matshidiso Moeti from Brazzaville in Congo. As I'm sure regular viewers will be familiar. But today we're also joined from Bamako in Mali by the Honourable Minister Safia Boli, who is the Minister for the Promotion of Private Investment, SMEs and National Entrepreneurship, and also from South Africa by Sipho Pitiana, who's President of Business Unity South Africa and the co-chair of the African Regional Action Group of the World Economic Forum. And delighted to have him coming. He's coming fresh from a cabinet meeting, so we're hoping to see him shortly. First, though, for our update on progress against the pandemic across the continent, can I turn to Dr. Moeti in Brazzaville? Dr. Moeti.
Yes, good afternoon, everyone, and thank you for connecting with us. I'm very pleased to be joined at this press conference by the Honorable Minister of Investment Promotion of Mali, welcome Minister, and the Chair of the World Economic Forum Regional Stewardship Board to discuss efforts to support small and medium enterprises in the wake of the COVID-19 pandemic. We know that this pandemic is dramatically impacting livelihoods, particularly because 70% of people in Africa are working in the informal sector. With a slowdown in economic growth related to COVID-19, the UN Economic Commission for Africa projects that up to 27 million people could be pushed into extreme poverty by the pandemic. At WHO, we're working closely with our sister UN agencies and other partners to mitigate the socioeconomic impacts, including by providing technical guidance that countries and businesses can use to enhance public safety in resuming economic activity at this stage of the pandemic response. We are encouraging a context-specific, risk-based approach with adjustments to facilitate physical distancing, improve access to hand-washing facilities, strengthen hygiene practices, and promote the use of masks over the mouth and nose in public. For example, in Niger, we are working with the government and partners to support disinfecting surfaces in health facilities, small businesses, and in households, and have set up around 200 hand-washing points in communities. Recognizing that knowledgeable and empowered communities play vital roles in preventing transmission of COVID-19, we're also scaling up grassroots activities. For example, last week in Chad, our staff were part of a door-to-door campaign sharing information on COVID-19 with more than 33,000 people. Activities like this help people to understand how they can better protect themselves and others, as well as combating misinformation around the pandemic. On the public health front, several African countries have recently increased their testing capacities for COVID-19, including Sao Tome and Principe, where we deployed a team this past week. In some of these countries, we're seeing an increase in cases, and in others, the new cases remain stable from week to week, indicating that we need to remain vigilant to stop the spread of COVID-19. We're continuing to support countries to decentralize and expand capacities so that every community can find, test, isolate, and care for cases, and trace and isolate their contacts. These public health measures remain fundamental as we move forward. And finally, as we learn to live with COVID-19, we should all be looking for ways to improve our societies and focus on collective well-being. This includes serving the vulnerable, enhancing equity, leveraging digital technology, strengthening local production and supply chains, growing the knowledge economy, investing in emergency preparedness, and building resilient health systems. Progress in these areas relies on an all-of-society approach with solidarity between governments and countries, between governments and the private sector and communities. I look forward to a very interesting discussion today And thank you once again for joining us.
Thanks very much, Dr. Moeti. We've talked before on this call about the impact the pandemic's having on the economic well-being of people across the continent. And obviously, governments are playing a key role in addressing those problems. Delighted to be joined from Bamako, Mali, by the minister there who's playing a leading role in addressing those issues, Safia Boli. Minister, can you tell us about the steps that are being taken in Mali, and perhaps the steps also that some of your colleagues on the Africa Regional Action Group that the World Economic Forum is coordinating are taking to address these issues?
Thank you very much. Also, I'm very delighted to join this effort alongside Dr. Moeti of the World Health Organizations and the World Economic Forum. It's also an initiative that we are supporting very much along with the Africa Regional Action Group, which was launched recently, as you mentioned, as well as the Africa Growth Platform, which are both key elements for us to not only ensure the resilience of small and medium enterprises across sub-Saharan Africa, in our case, in the case of Mali, more specifically. I'll give you a few, I would say, pointers about Mali. It's a landlocked country. We have 1,200,000 square kilometers, and we have 20 million inhabitants. So it's a very high density in some parts and a very low density in others. We have a strong economy that was growing at a steady 5% before the pandemic, in spite of the challenges in terms of security in the center and the north of it. When we were faced with the pandemic, which was declared in Mali in the middle of March, the government started a series of measures very early on in terms of checking temperatures of the borders before we went and eventually closed the borders in terms of movement of personnel, but left the movement of cargo going. So for the measures, the Minister of Health has been very active and dynamic in making sure that there is a very strong campaign of communication going on in terms of social distancing and in terms of other measures that need to be taken for the prevention. As of today, we have about 1,200 confirmed cases. We have about 80 deaths, but we have over 700 that have already left the hospitals and have been healed. So from that perspective, it's a very bright horizon for us. But when it comes to economic impact, what we're doing in Mali precisely, or what we're doing before the pandemic, was to establish a strong SME support program. Because the Malian economy is multi-layered, like many of the sub-Saharan countries, but many around the world as well. The two main contributors to our GDP is gold and cotton. We produced about 66 tons of gold last year and about 700,000 tons of cotton. The agriculture and agribusiness are very strong also in Mali, as well as the livestock. But if we look at the economy as a pyramid, these ones are the top of the pyramid. The bottom of the pyramid is very much the micro and small enterprises, which contribute to up to 70% to the economy, the majority of which are in the informal sector. Of course, being in the informal sector and being in, I would say, in the unstructured market, they were very much impacted by the pandemic in terms of the closure of the borders and, in the case, partial confinement. Mali never went into a confinement in the daytime, but when I say partial confinement, we had a curfew at night. So as a result, some of the SMEs that were operating at night, like meatpacking, bakeries, and small restoration, were heavily impacted for a period of about a month and a half, and had to adapt and find a resilience in the way of redoing their operations. For the larger part, we found that there was a strong impact on the tourism. The hotels, travel agencies were heavily impacted because travelers were not coming anymore as a result of closing the borders. We also had kept the borders open for cargoes, but naturally the cargoes also became slower and slower, because being a landlocked country, we depended heavily on importation. And that importation meant that the countries where we were buying those cargoes were operating and were not on full lockdown in order to produce the material in the factories that could eventually come to us. Because countries in Europe, such as Spain, France, and Italy, were in some form of lockdown for those factories and plants, it meant for us that the cargo also was slow in reaching small economies in Mali. So the economy was impacted in several layers in the larger aspect of it. The government put in place a few measures to relieve that challenge on the economy. Some of them were felt as the social measures, such as cutting completely the taxes on electricity as a means of reducing tremendously the cost, so that companies as well as households can have good access to electricity. For the most vulnerable population, electricity was given for free for about 2 months, which were the months of the toughest heat and temperature in Mali. So that was a means of social help as well. In terms of the financing, which really is the key to ensure the resilience of those companies, Mali had two strong measures. One of them was to expunge its own, what we call the interior debts. The interior debts is when SMEs have provided services or have sold goods to the government and the government hasn't paid them yet. So everything that was due up to January 2020 has been paid entirely, and it's a value of $245 million. These were paid because we also had a chance to have relief in debt payment for outside financing that we had contracted. In addition to that, companies in general, as you know, when they face an economic shock like the one that the pandemic has created, their natural reaction is to seek financing to either maintain their operation, therefore maintain the salaries and the means of doing business, or reduce significantly until there is a possibility. Now, seeking the financing meant for them going either to a bank or go to a microfinance institution. In the case of Mali, we noticed that the portfolios of the microfinance institutions were also deteriorating because those portfolios were dependent on savings in some part of it. And in a situation of pandemic, people tend to retrieve the savings. So we needed to strengthen the microfinance institutions, and we need to strengthen the banks as well. Now, banks are subject to regulations. They would not be loaning so easily as well. We needed to make sure that they had enough assurance in terms of their underwriting capacities to be able to lend to the small and medium enterprises. So the government of Mali gave about $35 million to a fund that we established, which was called the Fonds de Garantie du Secteur Privé. It's meant to be the underwriting, the one that supports the underwriting of the banks. So when a private company comes and seeks financing to remain in operation, the bank can just rely on that other collateral and give the loan to the small and medium enterprises. The same facility was given to microfinance institutions when they go and seek financing from the bank, to allow them to eventually give small funding to informal, to enterprises that are in the informal sector. So in summary, we had a series of measures, but the ones that directly impacted on the economy and on the SMEs were in the Fonds de Garantie, as well as the expunging the interior debts. It'll be a pleasure to stay on and also answer a few questions on details about other measures that we're putting in place in Mali. Thank you.
Minister, thank you very much indeed. And thanks for that very comprehensive overview of all the actions that your government is taking to address the crisis. Can I turn for our first question to Pauline Bax, who's based in South Africa with Bloomberg? We can hear from Pauline. We're just waiting for Pauline to unmute herself.
Sorry about that. Yes, thank you for this opportunity. My question is that there seems to be an emerging train of thought worldwide that lockdowns may not be always effective in developing countries and do more harm than good. And I would really like to hear your comments on
that. Both the Minister and I think Dr. Moeti perhaps can address that. Maybe Dr. Moeti, just first, lockdowns, we've seen them implemented around the world. Is there growing evidence that they can do more harm than good, or is that not based on the science?
Yes, thank you for that question. And I'm certain that's the question that heads of state, ministers of finance, ministers of health, these cross-governmental committees that are making policy in countries, and even we ourselves in WHO have been asking themselves throughout the process. As we've had several times, the lockdowns are always a matter of keeping a balance between having an impact on the spread of the pandemic, of the virus, and having the minimizing the harmful impact on livelihoods, on the economy. I'm not aware of evidence that shows that lockdowns are not effective in low-income settings. What we do know is that there had been projections made of a certain trajectory of this pandemic by various groups, including ourselves in Africa. And because the governments understood that the public health capacities had not yet been put in place at a stage in terms of decentralization, scaling up, that would stop the pandemic if we used public health measures like identifying cases. This was happening in the context of an acute shortage of testing supplies and contact tracing, etc. They took the decision to put in place these rather more drastic, comprehensive measures while buying some time to scale up some of these public health capacities. And we observe that this is being done progressively. Countries have decentralized testing, so this can happen quicker. They put in place some space and capacity for isolating cases. But at the same time, the consideration now is that the slowing down, which we did see in many countries, of the rate of increase of cases, has given the opportunity to scale up these public health capacities so that even as the lockdowns are being eased, which is what is happening in countries now, the capacity is there to follow the more usual public health measures. And even if there is an initial uptick of cases, as we are seeing in countries like South Africa, be more and more capable of stopping a very out of control spread of the virus. So that is what I would say, that this was always a challenging balance to maintain. But we think that the early implementation of lockdowns did have an impact. For sure, the impact, as the minister has just explained, on economies will be severe. But we know that an out of control spread of the pandemic could also overwhelm countries in other ways.
Thank you, Dr. Moeti. Minister, you, I think, explained very well some of the impacts that curfew has had on small businesses. Is there anything you want to add to that answer regarding lockdowns?
I think, yes, there is something very important that we have passed as a message also to our small and medium enterprises, which have also complained about the lockdown, the curfew, when we first put it in place. But we had to put it as a safety measure primarily. And we found means specifically for the meat packing, the ones that were heavily impacted, for them to have special access to very limited areas that allows them to maintain about 80% of their operations, and as well as the bakeries. But in terms of the heavy movement of the traffic in between individuals, the lockdown, in our view, has helped tremendously at the beginning of the spread of the virus as a means for us to strengthen our, not only the health system, as Dr. Moeti has explained, but also, I believe, psychologically, it was important that we all put ourselves in this situation. We have helped the private sector by having specific means for them to adapt and be resilient to it. But we were also very clear with them that our intention was to make it a short-term lockdown. So it was going to be a period upon which we'll have to tighten the belt for a short period of time. If it is successful, if we had to come to a time when it was much more difficult, then we had to make more drastic changes. I think as a balance also, one thing that was important that came out of this is that we had in Mali the emergence of digital companies for delivery of food, for delivery of things that came out, would not have probably surfaced as rapidly if we didn't have such a lockdown, at least in the evening aspect of it. Also because we are 20 million and our president has promised that there will be 1 mask per Malian, it meant that we had to either acquire or make 20 million masks. So we put into place a mechanism whereby our SMEs were asked to produce 2 million masks at sometimes odd hours of the evening in a lockdown space, so they can also contribute to the national effort. Just a few points that I thought would be interesting as well.
Wow, quite a challenge. I want to go to Nairobi and to the Daily Nation and Elizabeth Marab for a question. Elizabeth, can we bring you up, please?
I do have 3 questions. The first one is with regards...
Can we go for one? Because I know there's a lot of people with questions, so it'd be great to get one key question in. Okay.
The coronavirus cases in Africa are now at 162,000 cases with 4,000, slightly over 4,000 deaths. I'm wondering, with this increase, are African hospitals beginning to feel the pressure, seeing that in some countries, even asymptomatic cases are isolated in hospitals?
Thanks for that. Dr. Moeti, are we seeing an increased strain on hospitals across the continent? We're struggling a little bit with connection problems, Dr. Moeti. I think we're back. No, we're back with you. We're back with you. Okay. Can you tell us about the situation regarding hospitals?
Yes. I think the significant increase in cases has been in around 10 countries. We've seen, of course, the very significant increase in South Africa. And there we know that the government, I saw the Minister of Health was visiting Cape Town recently, and they've just transformed the Cape Town Convention Center, which is a huge space in which I have participated in conferences, into a field hospital. So some of the countries are very quickly ramping up the capacity to provide care. There's a large number of cases also in Algeria, in our region, that is in Nigeria, etc. We will overall, and then there are other countries where we're not seeing such a huge number of cases, and they are also repurposing some space for providing treatment. I think what I can say is that some of the countries where there is a rapid increase are starting to feel the strain. They are looking and working on ways to increase the capacity for case management. And just to pick up on the point about asymptomatic cases, we are very much encouraging that countries set aside space, in a sense, for isolation of asymptomatic people without necessarily putting these into hospital, because it would be good to spare the hospital space for people who really do need medical care, not simply isolation.
Thanks for that. And Minister, is Mali's health and hospital system bearing up under the current crisis?
I believe we're doing very well because our numbers are still manageable, as I mentioned earlier. But I think a point of public-private cooperation is the fact that we have also transformed one of our large exposition area into a possible expansion of our hospitals, and have placed about 200 beds in there to be ready in case our hospital system are not able to cope with the current spread of the virus. As it stands, as I mentioned, we have about a little over 1,000 cases that are confirmed. We have 700 that have already healed and are back home, and we have about 70 or so deaths only. So our hospital systems, for the moment, are coping well, and I think our measures are also doing well. Thank you.
Thank you. Got a little audio bleeding in from someone who's unmuted, so just ask if you could, just to check that you've switched off your microphone so that we can hear clearly our contributors. Going to go next to South Africa, Wall Street Journal, and to Aisha Dadi Patel for a question. Aisha.
Hi, yes, thank you very much. I wanted to ask on the Ebola outbreak in the DRC, has there been an analysis of new cases in Mbandaka? And can it be confirmed whether those cases are related to the outbreak in the East? Thank you.
Okay, can I turn to Dr. Moeti perhaps to answer that? And maybe her colleague, Dr. Yao.
Yes, thank you very much for this question. We're of course very concerned about this outbreak, this new, we think, outbreak of Ebola back in Mbandaka, where we worked very hard with the government for 3 months in 2018, and very relatively quickly were able to stop this outbreak. So at the moment, there are 11 confirmed cases, and 4 people have died. And we are working with the National Institute to do gene sequencing and try to see if there is any possibility that this could be the same virus, so the same outbreak that has spread from North Kivu. We consider this to be highly unlikely, and it was proven the last time when it happened the other way around, just as the outbreak in Mbandaka was ending, that in North Kivu, this is where the current outbreak, which has killed so many people, is started. So we do not think so, but we are working on gene sequencing to confirm whether it's the same outbreak. I think if we look at the distance, the difficulties in travel, and we look also at the fact that this took place now in the context of somewhat of a lockdown, we think it's highly unlikely that it's the same outbreak. But we will soon be able to provide information on this.
Thanks for that. Turning to Vinicius Assis from TV Globo in Brazil. Vinicius, can we get your questions, please?
Good afternoon. Dr. Moeti, why are there few confirmed cases in African countries comparing to in other parts of the world? Now, we are talking about underreporting, few tests, or what? And can Brazil learn any lesson from Africa in terms of facing this pandemic? Sorry if I did more than one question. Feel free to answer just one about Brazil.
Okay, Dr. Moeti.
This is a question that we are asking ourselves all the time, and but we are starting to see some emergence of what we think is a mixed picture. Certainly, if we look at rates of testing on average across the African region, African countries, there has been rather less testing per population in most of our countries than has happened in other countries. But I'll go back to what I've said before as far as an answer is concerned. At the beginning of the pandemic, before we started seeing cases in Africa, we had a very active alert system. So there were many, I think there were over 23,000, 25,000 alerts, which were tested and eliminated as being cases. So I think it's very important to emphasize that testing has been happening even before we started seeing cases here, when we were worrying about people traveling from China to bring the virus, and we eliminated that. And then secondly, it was possible at the early stages with the very good point of entry screening that had been established to identify people who had traveled from certain places, so many of whom were the initial cases found in Africa, who very often after arriving in a country after a few days started having symptoms, were tested and found to be positive. There is no doubt, however, that as the virus was spreading in the region, we've had an acute shortage of testing kits, particularly. So at a certain point, when it would have been great to have had more capacity to test, this was a challenge. And it remains to be somewhat of a challenge, even if we've managed to provide now and again more test kits, including the supplies provided by the Africa CDC and a charitable foundation in China. So we've also have a syndromic way of seeing if there are more cases through our sentinel surveillance system for influenza. So we believe if there had been a huge number of people with respiratory symptoms and fever all over countries, we would have found them with the sentinel surveillance system. That did not happen. In addition, some countries, even in this context of shortage, like Ghana and Senegal, have actually managed to, and Ethiopia, to scale up and increase rapidly in the past few weeks their testing. And we have not seen in those countries a huge increase in the number of cases. I think the Senegal example is a very good one. If we look at the graph, there is a very significant uptick in testing. And the graph, as far as new cases confirmed is concerned, has carried on at the same rate of increase. It's increasing, but not to show that we are discovering a huge number of previously undetected cases. Whereas we know in South Africa, they've scaled up hugely testing, have found a very significant increase in cases, but again, not proportionate to the degree to which the testing was increased. So we believe that there is some underestimation of the cases. We don't believe that it's a multiple-fold underestimation such that one day we'll find that many, many African people have died of COVID-19 who were never discovered. I think I can put it that way. What can Brazil learn? I think that African countries very early on selected to, because they had not scaled up public health capacities, selected to put in place very significant measures of social and physical distancing. We believe these have bought time. At the same time, they worked very hard to scale up these capacities, and I think very importantly, engage with people so that communities understand progressively their role, and we are seeing this in our countries. People are more aware and are taking action themselves to protect themselves and protect others from infection. Thank you.
Dr. Moeti, thank you very much. I want to turn to CNBC Africa now and Nosifo Mbwanja. Could we get your question, please, Nosifo?
Thank you very much. It's Nosifo. So the question for me is really, no worries. The question is really for me around the informal economy. What we are observing in South Africa is that the players in the informal economy have already started to engage in business. Now, what we have seen prior to this is that a lot of the government interventions in terms of supporting COVID-19 businesses have really been in the informal economy, even as they extended to small and medium-sized enterprises. But the informal economy, the microeconomy, those sectors have completely been ignored. And as they start to reopen, is there any practical advice that we could hear from the panelists around how do we make sure that the reopening of the informal economy is done with some degree of safety and some degree of regulation? Do we have examples where this has worked?
Thanks for that question. Minister, you're also not only involved in Mali's response, but you're in groups that involve ministers and other figures from business around the continent. Are there examples that you can give that would meet Nosipo's question?
Thank you very much for this question. Our goal has been to help the informal economy grow towards the formal. And we are conscious that many of the support that are provided there tend to be directed to the formal economy because they require some level of structure or regulation that the informal economy isn't in terms of engagement. In the case of Mali, we have made the support wide enough to be able to help each one of them. So in the case of the electricity, for example, when the cost of electricity is significantly reduced, it profits everyone. It profits the household, it profits the informal economy, and it profits the formal one as well. When we give collateral for microfinance institutions, which tend to engage very much with informal economies, we do have also means there to reach out and ease the informal economies. How can we make sure that the reopening is done easily and with some form of regulation? And I think that the challenge with the informal economy is that there is just lack of regulation there. It's probably the best way is to have a broader support mechanism that is more linked to the social aspect of it. But I think the informal economy is far more resilient than when we see it happening in terms of its relationship with formalized, structured enterprises. At the moment, we are just supporting different layers going down. So for example, in the cotton culture in Mali, We are a big producer of cotton, and we have established a state-owned company that deals with cotton cultures and buys the cotton from those who grow and harvest it to be able to subsequently sell it to the international market. The ones in the cotton culture that are growing it in the rural areas, the large majority of them are in the informal sector. So the help that we send to them, whether it's through subsidizing or it's through ensuring that they're accompanied through their learning process or through working through the economic shocks, is done to all. So in the case of Mali, we have assimilated the support to the social aspect of the population to also being able to benefit it by the informal sector. So if I could give an example of that, that's where we are at the moment in Mali. So some measures that are much broader, so they can be able to support all in terms of financing to microfinance institutions and supporting the heavy part of the balance sheet, which are the cost of electricity. Thank you.
Minister, thank you very much. We have two questions, if we can just take them together. First, Mario Baptista from Lusa News Agency in Portugal. Mario, first to you, and then to Simon Ateba from Today News Africa in the US.
Hi, Adrian. Thanks for having me. I wanted to know if you could elaborate on the situation in Equatorial Guinea. I believe the government has asked for the WHO representative to be removed from the country. I would like to know if that there has been a replacement, and also if you could comment on the situation of the outbreak in the country, in that country. Thank you.
Thanks for that. And Simon Ateba. Simon.
Yeah, thank you for taking my question. This is Simon Ateba from Today News Africa in Washington, D.C. I wanted Dr. Moeti to comment on breastfeeding and kids. I don't know if we have such cases in Africa where breastfeeding mothers have to feed their kids. Do they have to wear face masks? Do the kids have to wear face masks also? And what can you recommend? Thank you.
Thanks for those questions. I'll turn those over to Dr. Moeti and perhaps Dr. Yao.
Yes, thank you very much. First of all, on the situation in Equatorial Guinea, indeed, well, I mean, first of all, talking about the epidemiological situation, I think it's one of the countries where, according to the numbers that we have currently, there's an estimation that there's just over 1,000 cases in Equatorial Guinea. Because it's a country with a relatively small population. So by population, we estimated to be one of the severely affected countries in terms of number of cases. Even so, we believe that there is work ongoing to establish the public health measures that I have talked about. Our team has been working very closely with the government to establish the surveillance, the contact tracing, the isolation measures, the case management situation in Equatorial Guinea. I would say it's relatively early in the evolution of the situation in Equatorial Guinea at the moment, but we know that per inhabitant, they have a rather high number of cases for the size of their population. It is indeed true that the government of Equatorial Guinea has requested that we change the WHO representative, and we are currently working on doing that. I'd like to emphasize very much that we're committed to working with the government, to particularly working to support the people of Equatorial Guinea to be protected from the pandemic, and to work more broadly to ensure that the health of the people is improved with the support of our WHO team in Equatorial Guinea. As relates to breastfeeding and the risk of transmission from mothers to babies, I am not sure that we're recommending that women wear masks and put masks on their babies. I mean, in a way, people who are in the same household are essentially very closely linked. And for the moment, it is not yet recommended, as far as I know, the wearing of masks. But I would like to turn to Michelle Yao, who is my colleague, who is on the call as well, just in case there is a new latest guidance, which I'm not aware of as relates to how to protect in the context of breastfeeding, transmission from mothers to babies. If you permit Michelle to come in.
Michelle.
Thank you very much. I will go on the same line. The main issue is to reduce exposure. So if both of them are totally asymptomatic, there is no specific advice provided to breastfeed the kid. That should definitively continue. Now, it is another case if the mother is sick. In this case, of course, the mother should protect herself, and it's the same advice that is given to people to avoid person-to-person contamination. So if a mother is sick, of course, the mother should wear masks, but it will be difficult for the children to have a mask while breastfeeding. So it's just precautionary measures, but we did not advise otherwise. What mothers should do, I think they should continue breastfeeding kids, but exceptionally, if the mother is sick, is to have at least some specific preventive measure not to contaminate the children. Over.
Thank you very much. Ministre, est-ce que c'est possible que vous pouvez faire quelques remarques en français pour nos auditeurs francophones, peut-être?
Avec un grand plaisir. Merci beaucoup. C'est un grand plaisir de participer à cette initiative aujourd'hui avec le Forum économique mondial et l'OMS pour parler non seulement de ce que nous faisons en Afrique, pour pouvoir rendre plus fortes nos entreprises africaines face à cette pandémie. Et je sais que plusieurs de nos entreprises ont eu quelques difficultés à cause du couvre-feu ou à cause de la fermeture des frontières pour le mouvement des personnels et le mouvement des cargos qui était ouvert, mais qui plus tard s'est retrouvé naturellement réduit de manière à avoir un impact assez difficile sur nos entreprises. Nous savons que dans le cas du Mali, le gouvernement malien a mis en place plusieurs mesures, en fait une vingtaine de mesures, qu'elles soient d'ordre sanitaire, social, sécuritaire, mais surtout économique, qui rentrent dans le cadre du renforcement de l'économie. Tout ce qui est du fonds de garantie du secteur privé, pour assurer que les entreprises ont un financement facile qui leur permet de rester en opération, mais aussi l'épurement de la dette intérieure qui était de l'ordre de 100 milliards de francs CFA, qui permet d'injecter des ressources dans l'économie de manière à ce que ces entreprises puissent continuer. Nous savons aussi que plusieurs ont toujours quelques difficultés et nous réfléchissons de plus en plus avec nos autres partenaires du secteur privé et d'autres ministères pour pouvoir mettre en œuvre des mesures qui sont bien concrètes et qui sont bien axées sur ces entreprises aussi. Je vous remercie.
Merci beaucoup. We're going next to Nigeria and to Adeze Ojukwu from Next Edition. Can we have Adeze's question, please?
Okay, hello.
Hello.
Yeah, good afternoon, everyone.
Hello, Adeze. We've just lost you as we thought we had a line into you. So I'm going to turn instead, if I can, to Andre Van Wyk at allafrica.com based in South Africa. Maybe we can go back to Adeze in a minute. Andre Van Wyk, have we got you on the line? Just checking for Andre Van Wyk. No, not in vision. So we have a question from Kwame Boakye at Pulse Ghana. I think this is aimed at Dr. Moeti, asking, what's your take on Ghana easing the restrictions with churches and some students going back to school from June the 15th? Dr. Moeti, what's the WHO's view on the loosening up of some of these lockdown restrictions in Ghana?
Yes, thanks for that question. I'm aware that the government of Ghana has given a lot of analysis and thought to the process of easing up of these, if you like, social distancing measures, and has also very much based their decisions on data in terms of what's happening in each of the localities where this is being done. So my belief is that what they're undertaking a very progressive, thoughtful process. I am quite confident that when they are announcing that some activities can resume, it is with making it very clear what are some of the precautions that need to be taken as these measures are being released, including the numbers of people that can gather in religious ceremonies, the type of social distancing that has to take place, the hygiene measures that have to be put in place. And this would be also the case as far as resumption of school and classes is concerned. Clearly, there would need to be measures put in place so that you may not have students gathering in the level of, if you like, intensity in the numbers that would normally be sitting together in a classroom. That might imply then that there are sessions and sequential teaching of smaller numbers of children, which would have implications for the work that teachers have to do if they're going to be doing different sessions, teaching the same class. But I am very much aware that the Ghanaian government, because they were in communication with WHO as well on some of the guidance for these measures, is using data and a progressive process on easing up on the lockdown measures.
Thank you. Wondering if we can get our line into Adeze back. Just checking on that. Adeze, can we hear from you? If you've been on, yeah,
okay.
Perfect.
Okay, thank you very much. Yeah, my question is to Dr. Moeti. You can notice that before the coronavirus pandemic, the African health system, it has been described as very appalling. And Nigeria, for one, is a party to so many protocols on health and all that. And how can WHO help Africa and indeed Nigeria to improve its healthcare system? Because if it is not done, there's another outbreak. We might not be able to handle it. And again, the SDGs, the targets may not be achievable soon if we're not able to handle the health system with improved.
Thanks for that question. And we're just struggling a little bit with your line, I think, there, Daisy. Dr. Moeti, what can be done to help improve the capacity of healthcare systems across the continent in the aftermath of this pandemic?
Yes, thank you. This is a very important question. We've been working over a number of years with governments in the region, as well as the work that we do as WHO at the global level on strengthening health systems with a view to progressing towards what we call universal health coverage, making sure that everywhere where people are, they have access to essential health services, both to prevent illness and to treat disease in an affordable way. So it's very much, first of all, around investing more in health. I think there is no doubt that governments need to invest more in health and invest in such a way that they get the most benefit in improved health for their investment, because you can target in some ways or others and you can get better results or not. So we're working with them to very much focus on the most, if you like, the highest prevalent diseases, an integrated way of delivering services to people. We emphasize a lot working on primary healthcare so that there's a decentralization of, if you like, infrastructure, so people can have, even if it's a simple health center, but they can have somewhere where they go, where they will find a nurse, if necessary, a community health worker, with a good chance of being referred if they have a complicated illness to a higher level facility where they will find people who are competent, the medicines are there, and it's possible to have a service. So it's an overall package, but it very much emphasizes more investment, making sure that we have the key inputs of a health system. So health workers, for example. In many of our countries, the health workers are still concentrated in urban areas. And when you get out to the periphery, you find very few doctors and very few nurses. And this is what is driving not only ill health in terms of poor access to healthcare, but also the inability to detect outbreaks early when they occur. So we have a whole program of universal health coverage. What I can say coming out of this pandemic is that we see many, many opportunities to build on the investment being made on the pandemic response now to support even more strategically what countries have been doing to improve their healthcare systems. We've seen a lot of use of data systems have been improved. These must be broadened and used to provide broader service for action in countries. Laboratories have been improved. Partnerships have strengthened between governments and the private sector in countries. We would like to see this carried on beyond the COVID-19 response. So we have strategies, the countries have developed plans. We also have found different ways of working with partners, the donors. We're emphasizing very much an integrated, people-centered approach and minimizing what we consider to be sometimes inefficient ways of spending too much money targeting different diseases. If we got efficiencies in combining some of these resources, we think that we could go much faster to improving health systems in countries.
Thanks very much. Minister, are there examples that you would draw on from Mali's experience where the pandemic has changed your direction on healthcare investment?
Yes, I think if there is one thing that the pandemic has created is the understanding, I would say in the whole nation, that the responsibility to provide healthcare system to the citizens, while it's primarily the one of the government, but it's not solely the government's responsibility. So we have come to a place where we've had a very strong private-public partnership. Our Chamber of Industry and Commerce has put in place a lot of places and measures for the small industries to provide and produce either gel disinfectant to be able to sanitize your hands, or to produce the mask as well. But when it comes to the actual infrastructure for healthcare, I think what has really come across is that it's a dual responsibility for the private sector to establish the financing, as well as the equipment that are in place, and for the government to establish the norms and the criteria, as well as the architecture for it. But at this point in time, we have reached a level where we have a very strong private-public partnership when it comes to improving the healthcare system. We have a lot of donations that are made to the government by the private sector, either for testing kits that they have helped with other countries establish, or through combination, as well as hand sanitizers or gloves or masks. There is an outpouring of that from the private sector to the public healthcare systems. We also have private infrastructure, health infrastructure in Mali that have significantly cut down their costs to be able to support in the pandemic as well. So that dynamic that the pandemic has created, I believe, as Dr. Moeti has said, is one upon which we need to build upon to create the next generation of healthcare systems, to see it as a collective responsibility as we move on. Thank you.
Thanks, Minister. We're drawing to the close of our briefing, but I want to see if we can just take a couple more questions. We have Shego Lepule of Independent Media South Africa on the line, and we also have Mariam Issa, I think. So if we can go to Shego and Mariam just to get their questions in. Shego.
Hi, good afternoon, everyone. My name is Tseho. My question relates to the number of job losses that are expected as a result of the many social distancing restrictions that are put in place. What advice can be given to companies to, balance keeping jobs as well as staying afloat? Thank you.
Thanks for that question. And can we also hear from Mariam as well?
Like that was many people.
No, we are struggling to get hold of Mariam. So, so if I can put that question perhaps first to the Minister on businesses from Seho.
Why did you remove on mute? Can you hear me now?
Yep, we can hear you now. Thank you.
Okay, perfect. So yes, thank you very much for that question. It hits again to the heart of where the challenges are, jobs and incomes that are being lost as a result of the pandemic. What we have told our companies is that the pandemic is just another economic shock that they would have received. So if we're talking about, today we're talking about a pandemic, it could have been a natural catastrophe tomorrow, it could have been anything else. Companies, by their nature, are established to review means to remain resilient and remain in business. Now, as a result of that resilience that they built towards the economic shock, does it mean that they will be reducing their number of workers as a way of maintaining their operation, or would they just go to transform their business, the way of doing business, and adapt to the new ways of operating? So as opposed to having one line of business, seek for other lines of business. So we gave the example of if you were producing a cream that requires a manual application, and now we have social distancing, you can't have that. Well, think about having it in a way that you can be sprayed so that you can still sell it, but maintain a business. So for companies, we have encourage them to think of means to diversify and means of selling their same product or adapting to the economy as much as possible. When it comes to moments when all of these aren't that easy or possible, and that could be a case, there are national laws that look after what are the means for supporting jobless and unemployment for a period of time. Can you put your employees on a half salary for 3 months until the pandemic passes? And for that, what support can you obtain from the local government or from other partners in the private sector environment that allows you to continue? Seek financing from the banks to be able to maintain your core resources, which are the individuals, to the extent possible, and see to what extent you could have limited benefits within a short period of time, knowing that it will be difficult for all, but giving at least some hope of rehiring after the end of the pandemic, or at a moment where the companies and individuals have learned to live and work with the pandemic. I think there's also a message we're sending out now. We want to put all the means possible to ensure that the pandemic does not grow, but because for a company, being in operation is an existential question, we want them to build the resilience to be able to operate within a pandemic area. So building that resilience also could mean diversifying, having other type of benefit that you give to your employee that are less costly for you, but allows you to remain in operation. It takes a very strong public-private partnership for that, particularly when it comes to limiting the benefit for employees, and making sure that they get half of their salaries or limited salaries for a short period of time while maintaining a contractual status that guarantees a rehiring subsequently. Thank you.
Thanks, Minister. I think we have time for a very, very quick question from Mariam Issa, which will enable us also to go to Dr. Moeti for a final word. Mariam.
Okay, thank you. I was wondering whether, given Africa's young age structure, whether there are expectations that the fatality rate here will be lower than it is elsewhere, or will that be offset by poverty and poor nutrition in many places? And I was wondering what your latest projections were for fatalities in sub-Saharan Africa and in South Africa.
That's a great question for our final minute of the briefing. Dr. Moeti.
Yes, thank you very much. I mean, I think that if you like, the demographic, the youthful structure of the population probably is making a difference in terms of the case fatality rate in the region. So, for example, we're seeing in, now I'm speaking about the region of Africa, in North Africa, in Algeria, a country with a relatively strong health system compared to most of our countries. They have a structure of the population which is more like Western countries with a much larger proportion of older people than sub-Saharan African countries. And we have seen that the case fatality rate there is relatively high compared to other parts of the region. So we think compared to the healthcare system's capacities, this must be a factor. And so we are seeing indeed taking into account the gaps in our healthcare systems, the level of deaths in African countries is lower, and we're seeing a proportionately higher number of deaths among older people who are infected in our countries than among the younger people. The bulk of people who are infected is young. So this is making a difference. Of course, we need to continue as the numbers increase to monitor very closely what happens to people who have HIV infection, which predominantly affects younger people who are not on treatment, and be on the lookout for perhaps higher rates of death there than we would see elsewhere. We've made some projections in terms of what we were expecting to see if there had been no effective interventions around prevention and even these social distancing measures in terms of cases and deaths. And we've seen that what has happened, in fact, is quite different from what we were projecting in Africa. I don't have the exact numbers to project how many deaths we are projecting now, because we know that there is quite intense action in countries, not only to reduce the number of cases, but also to minimize those who progress to serious illness and deaths. We are learning more and more about this disease and understanding it's very important to intervene early and also to address some of the manifestations which we did not understand at the beginning, like microclotting, for example, to prevent people becoming complicated cases and dying. I think this is what I can say about the situation as far as mortality and structure of the population is concerned.
Dr. Moeti, thank you. And we're out of time on today's briefing. It remains for me to say a very big thank you to the Minister Boli, for joining us from Bamako, to our doctors, Dr. Moeti and Dr. Yao, for joining us. Our apologies that our guest, who was delayed in a meeting with the South African president, couldn't make it onto today's call. Our gratitude to all of you for joining and for your questions, and our apologies to those of you who we weren't able to get to. From Geneva, thank you for joining us.